Management portion of the course, the skill station that we typically will go over will involve intubation. Even though every clinician is not, it's not in their scope of practice to have to intubate, we still believe that every clinician should understand the process that is involved in placing an endotracheal tube. As is illustrated in the American Heart Association course, the process of intubation is going to require you to be prepared because compressions have to be stopped, and this will take an amount of time to place a tube. Although we don't want to intubate during CPR, if we can help it, there are situations where you are going to have to stop compressions and place an endotracheal tube. So first things first, make sure you have a device, the laryngoscope, that has batteries in it and your blade attached. Make sure you have appropriate size blade and that the light comes on when you extend the blade. Make sure that you have your endotracheal tube. Choose the appropriate size. In this case, our mannequin here is an adult male mannequin, so we've selected a size 8 endotracheal tube. And so we will prepare that by lubricating. In this case, in the skill station, we use spray lubrication to prepare the device. In reality, you would use a non-petroleum based lubricant to lubricate your tube to make sure that you have smooth passageway into the trachea. Make sure to test the cuff. So the cuff of the device should be tested with 15 cc's of air or more to make sure that the cuff inflates and remains patent after you've inflated it. You can then deflate the cuff. Make sure to keep your syringe handy. I always keep it attached. This way you know where it's at when it's time to place your and inflate your cuff with the tube in place. If you look at our mannequin here, the goal is to place the tip of your blade in the vallecula and then introduce the endotracheal tube into the trachea, which is the opening up here, and hopefully we can see the cords where the tube has to go. We're trying to avoid placing it in the esophagus. And so the whole point of our skill station here is to practice these steps and make sure that as clinicians we're able to either perform this skill effectively during a code or assist if necessary during the commission of resuscitation effort. So now that we have all our devices ready to go, make sure you have rigid suction that is attached and that is working. You'll typically have to suction the patient's airway, so position them. Suction the airway to make sure you've removed all secretions. When you're ready to go, extend the laryngoscope. Have your device ready at your right hand with your laryngoscope in your left hand. We are going to insert the blade into the vallecula of our client here and extend, lifting upwards and forwards until we can see the cords. Once we can see the cords, we place the tube directly into the trachea, making sure that the cuff has passed the level of the cords. Then we can remove the laryngoscope, place that down, making sure that we're holding on to the tube carefully. Remove the stylet, and then we are going to inflate our cuff with a 10 cc syringe. Okay, so remove the stylet and inflate your cuff. Inflate the cuff with the correct amount of air to make sure that the cuff is will maintain the tube position in the trachea. And then you do want to note your depth. And over here we'll have, in this situation, our tube is at about 23 measured from the lips. We also want to secure our device. In this situation, we can use this commercially manufactured device that has both a bite block and also a means of securing a tube. This device is introduced into the oral cavity, surrounds the tube in this manner. We want to make sure that we have a firm grip on the tube, and then this device can be secured around the side of the neck to make sure that our device, our tube, will not be dislodged. Make sure to extend your patient's head back into the neutral position and then lock it in place. This device allows you to suction through a port on the side here, and so you still can perform oral care with this device in place. Attach your bag mask device and ventilate, making sure that we're in the appropriate spot. As we ventilate, we should have someone prepared to auscultate to make sure that we are not in the epigastrium. So we'll ventilate, make sure that there are no breath sounds over the epigastrium. We'll ventilate and make sure that we have breath sounds over the left side, and then ventilate and make sure that we have equal breath sounds over the right side. The reason why we go left then right is to make sure the tube did not bypass our left main stem and go down the right main stem into the right main bronchus. Once we've confirmed tube placement with those clinical means of assessment, then we can use some other physiological monitors. The first being our colorimetric device. This device sits right on the end of our endotracheal device, in this case the endotracheal tube. Then we can attach our bag mask device, and as we ventilate, we should see a change in color as the patient breathes in. As we ventilate in, the color should be purple. As they exhale, the color should go to yellow. So this is our colorimetric device for capnography. We can then also attach capnography. Capnography involves having a module on your monitor that will give you a waveform and also measure end-tidal CO2 as a digital readout. This device also attaches directly to your endotracheal tube and then allows you to ventilate directly through it. Once again, you're ventilating and you should see a readout on the monitor as you ventilate. Finally, you can also attach, during CPR, you can also attach an impedance threshold device. This particular device is called a rescue pod. These devices are designed to enhance circulation, basically by creating a vacuum in the mediastinum by collapsing the lungs when the patient is not being ventilated, and then allowing that, which then allows the heart to fill up more rapidly and more efficiently with blood during your relaxation of CPR. So all these devices are devices that you may encounter in any code situation, whether you are the individual who is tasked to place a device or whether you are a clinician who's assisting. It's important that you have an understanding at every level that makes you a better assistant and also a better clinician. What we didn't illustrate in this short clip was inflation of the device with a 15 or 20 cc syringe. Make sure that you inflate the cuff to the correct pressure.